We're good. Yeah, we're good. You can click us on the live whenever you're ready. Okay, thank you. Good evening, everyone. We'll call the meeting to order. Before we call the roll, we'll take care of a little bit of legal business. State pursuant to Executive Order 2020-07, 2019 ILEO 20-07, issued March 16, 2020, during the duration of the COVID-19 gubernatorial disaster proclamation, the provisions of the Open Meetings Act 5 ILCS 120 regarding or relating to in-person attendance by members of a public body are suspended. Specifically, the conditions of 5 ILCS 120/7, limiting when remote participation is permitted, are suspended. The DuPage County Health Department is the lead agency for DuPage County in response to the global pandemic, and as such is currently closed to the public, except by appointment, in adherence to public health guidelines and for the protection and safety of the public and staff. Tonight's meeting is being conducted remotely and being live streamed for the public's viewing on the agency's YouTube channel, which can be accessed at the live stream link on the Health Department's website. Members of the public have the opportunity to submit written comments in advance of the meeting. The method for public participation is publicized on the Health Department's website. Public comments will be read and recorded in compliance with the Open Meetings Act. That being said, welcome everyone. We'll call the meeting to order. And Penny, if you would call the roll.
Ms. Bottoms?
Here.
Ms. Finch? Ms. Geider?
Here.
Dr. Hussein?
Here.
Dr. Munir?
Here.
Dr. Scouten?
Here.
Mr. Spadoni?
Here.
President Tornatori?
Here.
Dr. Weeks?
Here.
Dr. Wilson?
Here.
Mr. President, you have a quorum.
Thank you. Moving on in the agenda, that portion of the agenda under public comment. This is an opportunity for members of the public to weigh in on various issues, hopefully those that are on the agenda and that are relevant. And with that, Penny, I will turn it over to you for our public comments that have been previously submitted.
Okay. Heather Beck, Carol Stream, more and more experts are coming forward claiming that the misuse of the PCR test is resulting in a vast number of false positives. Many are denouncing the test as fraudulent and illogical, that it shouldn't be considered diagnostic. These are the very tests used to justify restrictions. I'm a DuPage resident. I'm asking your board to invalidate and retract numbers that lead to deception. Fraudulent reporting during a state of emergency is a felony. A cycle threshold of 34 cycles or more means that the test is useless as a measure of a true positive case. The test must be run at 17 cycles, otherwise accuracy is increasingly questionable as cycles increase. The chance that a false positive result is received above 35 cycles is 97% or higher. I'm asking DuPage Health to only count results that are run at 30 cycles or less, publish the PCR cycle threshold for DuPage County testing, retract any and all case numbers that are based on cycle thresholds above 30. Accuracy is of utmost importance in a public crisis. Comment, Rebecca Harpster, Elmhurst, to the DuPage County Board of Health and Executive Director Ayala. I am writing this on January 31st, 2021. As the time of this writing, the DuPage County Health Department has still not changed their stance on in-person schooling. Despite reams and reams of data that show in-person school is safe, you continue to stay quiet and you recommend remote learning, but it is up to the individual districts. I am severely disappointed in your lack of leadership. I suggest you take a page from the Chicago Health Department playbook and their amazing leader, Dr. Arwady. She is advocating for the children that are under her care in Chicago. You should be doing the same. Please advocate for the children of DuPage County. If you don't, I suggest the Board of Health consider hiring a better leader for the children and families of DuPage County. Comment, Mia Allen, Elmhurst, to the DuPage County Board of Health and Executive Director Ayala. I am writing this on January 31st, 2021. As the time of this writing, the DuPage County Health Department has still not changed their stance on in-person schooling. Despite reams and reams of data that show in-person school is safe, you continue to stay quiet and say you recommend remote learning. It is up to the individual districts. I'm severely disappointed in your lack of leadership. I suggest that you take a page from the Chicago Department playbook and their amazing leader, Dr. Arwady. She is advocating for the children that are under her care in Chicago. You should be doing the same. Please advocate for the children of DuPage County. If you don't, I suggest the Board of Health consider hiring a better leader for the children and families of DuPage County. Comment, Cecilia Grebs, Elmhurst, dear Director Ayala, what has the DuPage County Board of Health's recommendation, why has the DuPage County Board of Health's recommendations still not changed regarding in-person school. I am sure you are familiar with the study after study showing that in-person school is safe with layered mitigation such as hand washing and face masks. The CDC published a study last week showing almost no spread in school, even in areas of high community COVID transmission. As a public health official, I am surprised you aren't more concerned with the mental health and loss of academic and social emotional learning affecting our children. Our district is pointing its fingers at you as to why our children aren't in school full time. Please take leadership, change your recommendation to supporting full in-person instruction for our children. Thank you, Cecilia Grabs. Comment, Kim Vallis, IDPH, what more will it take to see our children need in-person schooling, in-person learning full-time and at full capacity, not remote, not hybrid, in person? The science is there, the data is there. Health officials from the CDC, WHO, AAP, and MIMS have provided sufficient statistics that have proven schools are not COVID super spreaders. Tell me, are you not concerned about our children's mental health? Have you looked at the youth suicides? Have those stories not affected you? The virus has a 99% survival rate. There is vaccine available. We pay high taxes to provide our children the education they deserve, and they sit in the dark rooms, videos off, on mute, and all for what? Definitely not an education. Enough is enough. Benjamin Widrovitz, Downers Grove, I understand there currently is a shortage of vaccine doses. That said, I and many other people in my neighborhood are running around trying to get appointments and status if we had signed up in one place or another. This certainly ties up the phone lines, etc. I know you have signed up for web facilities and do places like Osco, etc. But all too often, once signing up or reading updates, try to find any people, just see zip, nothing, nada. I don't mind waiting. I know we must do that. What I mind is not knowing if we have a slot in the future, albeit no definite date, and I need to get some reasonably regular emails to let me know and my wife that are on some list and not forgotten. A typical issue is that companies like Osco have sites for getting appointments, and at least around us, Downers Grove, I have the sense that Osco is not giving injections. But to be honest, I just don't know. So some greatly improved communications, please. Comment, Nicole Peckerick, Naperville, please reconsider your recommendation of the 6-foot distance for elementary school children. Our kids need to return to the classrooms for full days. 2.5 hours a day is not cutting it for these young children. A 3-foot guideline would allow our children to attend full time. Thank you, Nicole. Comment, Sarah Forster, Naperville, 63 days ago, over 200 people commented on the havoc that has been wreaked by the DCHD guidance that directs schools to stay all remote due to COVID, or at best requires in-classroom 6-foot distances between children, even when COVID positivity rates are below 5%. The CDC is updating its school guidance, which should be aligned with the WHO's, which states that 1 meter distancing is enough for schools with adequate ventilation. Does the DCHD care about the mental health crisis created by closed schools due to the DCHD's overly restrictive school COVID guidance? 63 days, that's 9 weeks. 9 weeks with no DCHD action. 9 weeks longer that DuPage County school kids have had to suffer. It is time to update the guidance, remove the suggestion of protracted remote learning, reduce the in-school distancing to 1 meter or 3 feet, admonish districts to keep schools open 5 days a week for the health and safety of the kids whenever possible. For kids' health, require the schools to reopen now. Comment, Chad Treisch, this is a federally funded vaccine and the recommendations by ACIP should be followed, and the guidance should only be allowed to be added to, not allow for a single group to be erroneously removed. ACIP has specific guidelines for 1B priorities, which place higher ed in that group and should have not been removed, and the science be followed. Higher ed includes many services outside of just classroom instruction. Outside of just classroom instruction. Higher ed is very robust. Operation includes communal living dorms, nursing services, 24/7 building operations, grocery stores, COVID testing operations, support services for actively infected COVID-19 students, COVID-19 quarantine and isolation, coordination, including food service and custodial, police, housekeeping services, and so much more. I'm sorry, I just lost my spot here. So much more that places staff at higher risk. There needs to be immediate specific guidance from DCHD to support the essential workforce who happen to work in higher ed and are eligible in 1A or 1B without the higher ed specific designation. Comment, Garcia Evie, Naperville, please carefully consider the recommendations you are making for schools at this meeting. I feel the health department has minimized and ignored the importance of the mental health of our youngest citizens. My husband and I are raising 4 children under age 10 in Naperville. When we saw that our school district would not be opening in the fall, we chose to homeschool our children and give them a piece of normalcy. However, we have all grieved the loss of our beloved public school and recently enrolled our children back again so that they could attend for 2.5 hours a day, 4 days a week, the maximum offering our district is providing. The district has told us that our school will not fully open until the 6-foot spacing issue is changed. We have all seen across the country schools operating successfully full-time. It is safe and it is important that we bring back our children to school full-time and give them as much normalcy as possible. They are carrying too much of this burden unnecessarily. Comment, Jane Hogan, Elmhurst, please update your return to school framework. I've spoken with the analyst of the Northwestern COVID data tracker by ZIP, and he says that due to the volume of testing, we need to focus on positivity rate instead of cases per 100,000, which because of the testing volume will always put us in substantial transmission. Please update your quarantine guidelines to match with the CDC. Please take a look at the research that shows 3 feet suffices for children with masks. At this point, the DCBH is the reason our public schools can't return to full in-person school. Why do you continue to do this to our children who are not at risk for serious illness or death from COVID? Our teachers are being vaccinated. Who are we protecting anymore with this outdated guidance? Please make our children and their education the priority. Please stop recommending remote learning on your website. Comment, Amy Nelson, you need to review and revise your return to school framework. It has not been updated in 6 months. We have so much more data on this virus, and you can certainly make more scientific and educated recommendations at this point. Mental health is equally as important as physical health and should be considered accordingly. Kids need to get back to school, and many are not based on your DCPH recommendations. Comment, Kate Foyts, Elmhurst, I am writing to express my concerns with the back to school plan. My 3 children are struggling at home on Zoom, and especially my 6th grader is struggling emotionally and mentally. She is withdrawn, unmotivated, and unable to make social connection with their peers or teachers. She attends a new middle school, new teachers, new friends. I am extremely concerned about her mental health and that of the other students. She is seeking therapy once a week, but I worry about her moving forward. I am asking you to please update your back to school guidelines to allow our students to get as much in-person learning as possible. Now the teachers are being vaccinated and have proper masks, etc. It is essential we put our kids first and get them back in school full time. Thank you for your time and efforts. Comment, Rachel Mikula, Elmhurst, to whom it may concern, the current DuPage County framework for returning to school has not been updated since 8/28/20. The current framework does not follow up-to-date CDC guidelines, which explains that distancing can now be 3 feet, not 6 feet. Eating in the building is safe, and a full day in-person model is safe and achievable immediately. Please, the children of this county, the community you serve and represent are suffering as they continue to fall subject to a lack of up-to-date scientific models that make it easy for districts to continue with remote hybrid model. This model continues to fail the academic, social, and mental well-being of the children of this county. Please roll out the most up-to-date framework that will help get our children back where they need to be in the classroom full-time with live instruction. Thank you. Comment, Aaron Danielson, Elmhurst, please urgently work to update the return to school framework issued by DuPage County. The current recommendation is remote learning and has not been updated since late August. This is not in line with CDC or WHO recommendations. Yet our school districts are referencing this county's frameworks when making decisions. Please update in accordance with the most recent national guidelines and stop being a roadblock to our students receiving full-time in-person education. And that concludes the public comments.
Okay, thank you. Thank you, Penny, for that. And thank you to all of you who chose to take the time to comment. We hear you. Moving on to President's remarks. Welcome to our first meeting of 2021. And this isn't the understatement of the year. A great deal has happened since we last met over the last 2 months. We're going to hear about our vaccination efforts in a few minutes from Karen, but back in December, we were focused on testing in schools, and we've moved from different tiers and different phases. But in addition to COVID, we've done some other things, and we welcome the Joint Commission for our regular accreditation site visit. That was done virtually. We've received positive feedback in response to our federal fiscal audit with no findings. That's a good thing. No concerns and adequate controls. And we passed the accreditation visit for our Healthy Families Illinois program, which is designed to reduce child abuse, neglect in vulnerable families. And of course, there has been much going on regarding COVID, be it testing and now the vaccination rollout. That being said, we will now turn it over to Karen to give us our public health update and in particular our COVID update. Karen.
Thanks so much. And while Chris is pulling up the PowerPoint to walk through, primarily what we're going to be talking about is our vaccination strategy and efforts. However, I think it's very important to note that we have continued with all of the other strategies. So we continue with support of our testing location over in Villa Park. We continue with our contact tracing case investigation. We continue with our health education promotion efforts, and we continue with our health equity action response team to address the disproportionate impact that COVID has had on our communities. So all of that has continued, and then we've layered on this mass vaccination effort as well. I'm seeing two slides. You got, yep. There we go. All right, so we're really thinking about this vaccination campaign as an effort to protect DuPage and really return our lives to normal that we haven't seen for now over a year. So tonight I'm pleased to provide this update to you. When we talk about mass vaccination or vaccinating an entire population, I think we are for those of us who have been around for a while, our thoughts go back to the long lines of whether it be the H1N1 or polio or something else, where we had long lines of people. There was one central location to get vaccinated at. Vaccine supply was not an issue, so you could bring everyone with you, and the risk of contracting the disease while standing in line was not viewed as a considerable threat. And all of those factors make what we're doing currently look and feel and be very different than the vaccine efforts that we have had in the past. Because of the significant vaccine inventory challenges, we know that we needed to prioritize groups of individuals. We're relying on CDC ACIP and the IDPH to identify the categories of individuals. So we have about the top of the sphere, or the tip of the sphere, the top of the pyramid, as far as high-risk individuals are healthcare personnel and congregate care staff and residents. And that congregate care staff and residents includes, of course, our long-term care and nursing homes, where large numbers of elderly populations live, but it also includes our SILA facilities and some of the group homes that we have or all of the group homes that we have in our community as well. We estimated that there was around 58,000. We are thinking that might have been a low estimate. However, we anticipated that it would take us about 8 weeks to substantially achieve a substantial vaccination rate in that population. And in fact, it has. So on January was it 25th? We transitioned to the 1B to offering opportunities for vaccination as vaccine is available to the 1B category. Those are frontline essential workers and individuals over the age of 65. So frontline essential workers are different than essential workers. Frontline essential workers are people who can't do their jobs remotely. And at the same time, by virtue of doing their jobs, they are exposed to individuals or potential for infection by virtue of simply doing their jobs. So in that we see, and further, that if they were to get sick, there would be a significant disruption to our society. And so we see indications of those or examples of those frontline essential workers being school teachers, but also bus drivers, and most recently the governor added snowplow drivers and grocery store workers and food manufacturers and manufacturers of healthcare products and devices. And so this category we know will be substantially larger and is at an estimate is around 270,000 individuals. Now, we anticipated that it would take us about 12 weeks, but again, all of these estimates are contingent upon a certain level of vaccine being available to us on a routine basis, and we'll talk a little bit about those challenges. After 1B comes 1C, and those are individuals who are 16 to 64 years old with medical conditions that increase the risk for severe COVID-19 outcomes. Those are things like diabetes, heart issues, obesity, other things that we've heard about in the media, asthma, things like that. As well as an expanded list of essential workers. And then finally, phase 2 is the rest of the population. So each county has the task and challenge of setting up the vaccine distribution for their communities. We have gone with a hybrid model of both a centralized location operated by the DuPage County Health Department, as well as decentralized partnerships across the community. So hospital clinics, pharmacies, outpatient medical groups, as well as employer-based clinics when possible. As of today, we have 108 approved provider sites in DuPage County. Now, that does not mean there are 108 places that are getting vaccine. And again, this will be a theme that you will probably get tired of hearing. So next slide, please. They are, however, scattered across our community because right now we know we have very limited vaccine supply. However, the promise is there and the hope is there and the plan is there that vaccine will become much more available in the upcoming weeks and months. And so we want to make it very easy, convenient for individuals across the county to get vaccinated. One of the suggestions that we hear a lot about is, well, if not enough people are getting vaccinated, why don't you just increase the number of places that are doing the vaccination? Why don't you just give the vaccine out to more people? And I think it's important to remind people that this vaccine is a medical product, that there has to be requirements and structure around who can provide the vaccine. So to that end, in order to be an approved site to provide the vaccine, healthcare providers must have that in their scope of practice. There must be medical oversight and direction for vaccine, and they must have an approved, be approved within the eye care registry to receive the vaccine. All of those things point to the quality and efficacy of the vaccine efforts. Sorry, I have random dogs in the background. So where are we at? And I am very excited, and this is the global debut of this information. So we have been vaccinating, as many of you know, since the third week of December. So the week of Christmas, our staff doubled down, started getting the vaccine out into our community's arms. And since that time, our shot count, if you will, stands at 132,559. The breakdown of those, that information is listed between Pfizer and Moderna in the chart right under that. And a couple of notes as we walk through this page. These data represent people who received the COVID vaccine at DuPage County vaccination sites, irrespective of their county of residence. So if you remember, when our vaccine efforts began, we talked about we will vaccinate people who live or work in DuPage County. And so this is that population. Our vaccination site types include private clinics, public clinics, community health centers, hospitals, local health departments, and pharmacies. Unfortunately, over half of the vaccine recipients had race reported as unknown. And I say unfortunately because that is an element that we are extremely concerned about and committed to as one of our underlying principles in this rollout, in that we want to make sure that we have high rates of vaccine available to the populations that have been most impacted. And those populations that have been most impacted are populations of color. And approximately, the other remarkable fact is that approximately 2/3 of vaccine recipients are female. So if we look at the breakdown, again, the Pfizer and Moderna vaccines both require 2 doses. So if we look at who's received at least 1 dose, we see that about 36% of the individuals listed their race as white, about 3% as Black, a little over 5% as Asian, but concerningly, 55% had unknown in that race category. When we look at ethnicity, it's even more concerning because 98% had unknown listed. However, when we look at age groups, we see that the bulk of our vaccinations have gone to the 16 to 64-year-olds. That is primarily the healthcare personnel who we've focused on. And then another almost 40% have gone to individuals 65 and up. Again, we see the gender breakdown, that 65% of individuals who received 1 dose are female and 33% are male. But we're not satisfied with 1 dose. We want people to be fully vaccinated. So we look at the fully vaccinated breakdown. We see similar numbers. When we look at the racial background, Ethnicity, again, has 98% nearly unknown. Again, we see an even higher level of individuals in that 16 to 64 who have completed their vaccination series. And the difference between females and males is also a little bit higher. I say this is the global debut. We have been working and asking and pleading with IDPH. We enter all this information, our partners, our provider, vaccine provider partners enter this information into this iCare system. But then we are not able to independently pull data or information or reports out of the system. And so it has been only the result of Dr. Chug and her team's persistence that we were able to work with IDPH and provide you this update this evening. Now we get to vaccine capacity or vaccine allocation. When we started our vaccine efforts, we and I think the rest of at least the US thought that, you know, we'd have a couple weeks of fairly low vaccine numbers, and then we'd see a increasingly robust supply of vaccine. And unfortunately, that has not been the case. So to date, the local health department, we have received 105,475 doses. But you see that the vaccine that we have received has bounced all over the map. And most concerningly, you see that the week of the 7th through the 13th, we're seeing an all-time low of 2,450 doses that's being allocated to us for the entire community. So how do we get the vaccine? It starts at the federal level. The feds allocate a certain number of doses to Illinois. We do not know what that allocation is, but then IDPH allocates to us and all of the other local health departments. In turn, we break it up further and allocate to our vaccine providers on a weekly basis. And then our vaccine providers, including our own clinic, actually put the vaccine in people's arms. So when we look back and we say we have robust capacity to provide vaccine administration across the community, I think that it's helpful to quantify. And so we have been working with our partners since before we even received vaccine to really cement the partnership, the expectation, and the sense of commitment from these different groups that it's going to take all of us to get people vaccinated in our community quickly and efficiently. So when we did a poll of how many doses our partners and ourselves could provide as of February 1st on a weekly basis, we see that there's about 18,000 the opportunity for about 18,000 doses to be going into our community and providing protection to our residents. Now, again, there's only been 1 week that our vaccine allocation has exceeded that, and most weeks it has been about half of that. So there's a very stark difference between our capacity and our supply of vaccine. But we have continued to ramp up, including the opening of our fairground site and the transition from the lower level of the health department or the clinic level of the health department in Wheaton, where we began doing the vaccine clinic the week of Christmas. We've been able to, as you see, about 400 or 500 individuals a week. Now that we're over at the fairgrounds, yesterday on our very first day of operation, where you typically see some of the lower numbers in capacity, we saw nearly 1,000 individuals. So we know we can easily provide 5,000 vaccines to individuals a week. And all of our other partners too could increase so that we could actually push out nearly 50,000 doses a week with our own existing resources. Now, how do we decide who gets vaccine on a weekly basis? We prioritize and evaluate our decisions and the request for vaccine around some principles, and it's whether or not the clinics are open to all community members who are, of course, in the eligible priority phase, whether the individuals who they'll be potentially vaccinating will be coming from an area in the top 10 census tracts that are based on CDC's social vulnerability index. Is the clinic actually located in one of those census tracts so that residents can easily access it? And finally, are the clinics open to Medicaid and uninsured individuals? We set a threshold of a very low number, but at least 10%. This week, we proudly administered the 100,000th dose of COVID vaccine in DuPage County. And I think the next slide shows how, yes, DuPage is actually leading the collar counties. So we have over 3% of our population fully vaccinated in spite of despite the limited supply of vaccine. Our rate is higher than the state of Illinois and all of our collar county partners. Again, we are pleased with this, but you'll see the 7-day administration, 7-day rolling average. That's on a daily basis. How many vaccines are we putting? Are we delivering? That number has been going up and up. So now we're at 3,948 on a daily basis. However, we can only do that if we have vaccine, and next week we'll get a total of 2,450 doses. We also continue to provide public health guidance for our local partners. So providing presentations to the county board. We have weekly meetings with hospitals, and we have long-term care consultations happening all the time. Schools in the ROE, police, fire, EMS, mayors, managers, as well as local businesses. So we continue to meet with those individuals because not only is the vaccination process challenging and difficult to understand, and we want to keep those lines of communication open, but also the guidance from CDC is changing as we become more familiar with this disease and more research is done. A big question that we get a lot is, what can I do while I wait for my appointment? First off, there was a lot of confusion around the fact that when you signed up on our webpage or in other places, that's not actually an appointment, that is a registration to put you in line for an appointment. We are still working through the 1A category of individuals in our clinic. However, we have given the go-ahead of our community partners to be entering into 1B. So we encourage people to do their research, continue to check social media websites. New locations for vaccines are updated weekly, in some cases daily. Again, being an approved vaccination site does not indicate that you'll have vaccine. And finally, making sure that you check your eligibility. So we are going to be continuing this phased rollout. We will continue to accept registrations from individuals regardless of the category. However, we are going to walk through these groups in a disciplined, logical way so that we hit the individuals who are at highest risk first before expanding to other groups. In addition, it doesn't matter where you get your vaccine. The vaccine is the vaccine. So we encourage people to register, check with their primary care provider, retail pharmacy, check the state of Illinois map, take the first available appointment at whichever location you can. And finally, don't get discouraged. I think a lot of people feel like they're the only ones having a challenge getting an appointment, and that is absolutely not the case. It is ridiculously difficult to get into and have a vaccine scheduled at this point. And again, though, it is not because we don't have a plan. It is not because we don't have ways of providing that vaccination. It is only because we don't have vaccine available. We also encourage people, and you've heard this, to understand other ways of protecting themselves, to continue to wear masks. Now we're hearing about double masking. We're still recommending, as does the CDC, 6 feet of distance, avoiding large crowds, making sure that you stay home when you're sick, and doing all of the things that have helped us really turn the trend of the disease and the viral spread in our community. We offer many, many tools about vaccine. And so I would encourage you to check these out. There's social media posts, there's videos, there's handouts, there's all kinds of information that our health promotions team has curated and put together and in some case developed. Additionally, we do a weekly vaccine media release. Typically that's been on Wednesday. And finally, we offer our ongoing newsletter that's released on Friday afternoons. So now, ready for questions.
Any questions of Karen from members of the board or comments?
I had a question. So you said next week you're only getting 2,500 doses. Is that what you said?
That is what I said, yes.
Yep.
And what was that compared to other weeks or?
So 10,225 last week. And I think it was like 12,000 the week before.
Do you get an explanation about why so, or is this just,
We get an explanation, but to be quite candid, there's not a lot of transparency in the allocations being provided to us by the state. So they have answers to why we are getting so much less this week, but it doesn't really quite make sense to us. So what I can say though is we have the full support of not only Sam as the Board of Health President, but also Chairman Cronin to be advocating and really pushing at the highest levels of the state to obtain additional vaccine for residents.
Karen, hi, this is Jan Guider. Excellent job. And I'm going to talk to you later about where I want you to use those slides again this week, next week. Okay. I actually, about a couple of hours ago, there were several governors on the evening news complaining. I think we are probably very fortunate to get to 2,000 next week. Okay. There is a general across the nation, we just don't have enough. So I think at this point, we just look at what we can get and say thank you. I don't think it's about lack of transparency. I just think poor planning from the very beginning has put us in a position where all we can do is hope for the best, try to catch up and be prepared, because I think I also heard too today that 2 million additional doses have been secured for the United States in manufacturing at least. So, I think you're doing the best you can with what you have. So thank you.
Thank you.
Karen, it's Mindy.
Mhm.
So my question is about, there's a lot of other counties that are prioritizing 1B now. They're actively vaccinating 1B, and we're prioritizing 1A, which is, I'm hearing a lot of it from school boards saying that their teachers have to go to other counties, they have to go anywhere they can go, while DuPage, where they reside and work, they can't get the vaccine. So they're having to go to Kane County and Kendall County and all the other counties trying to get this vaccine. So I guess why, if 1B is able to be available, can these appointments be opened to 1B? And also I know many teachers that signed up for 1A spots and took, even though they're 1B. So are they, I guess my second part of the question is, are they being turned away when they show up because they're an educator taking a 1A spot?
So I'll start there first. And no, it is, since we're in 1B, if they come, even if they mischaracterized or misunderstood the registration, we still provide them with a vaccine. We have, I think it's really important that there has been, we estimate there's around 40,000 individuals in the education sector in DuPage out of that 270,000. There has been a significant number, and I'm thinking it's around 15,000, maybe less. Ideas, Chris? I know it's at least 10,000 teachers who have received vaccine. And so it's not that teachers aren't getting shots, but the other principle we're using is that teachers absolutely are part of 1B, but so are food manufacturing employees, and so are people over the age of 65. And so we're not going to prioritize teachers over the rest of these individuals, but we are providing them with opportunities. We're not having, the hard part is we're not having clinics like, for instance, Kane County is. And again, I'm not saying this to cast dispersion at all. Every county has to make their own choices, and these are really, really tough choices. So Kane County has taken the last 2 weeks, I believe, taken all of their vaccine and provided it to teachers. Well, in order to do that, we would not be vaccinating people over the age of 65. We would not be vaccinating these other individuals. When we did not feel like that was an equitable approach. So yeah, but again, all of this would go away if we got adequate doses. We could get our population vaccinated in about 2 months.
Thank you.
I think it's interesting, and again, just so everyone knows, we have probably if not the most equitable, one of the most equitable systems developed to administer the vaccines. You sign up and you get called as you sign up. There is no sub-prioritization, if you will, like there may be in other counties, which I think is fair. And to show you how the teachers have been putting the pedal to the metal, if you will, they would like to sub-prioritize their sub-priority. I've gotten calls from school districts in certain areas who feel that their teachers ought to be vaccinated before teachers in other parts of the county because of a particular demographic that they might have. And my response to that superintendent was, if we were to do that, then we would have to sub-prioritize the people who work at Jewel, who are in certain areas of the county, as opposed to people who work in other areas of the county. That would again be unfair. So I think the way we do it is very fair. And Janice, God love you. I don't share your thoughts about what's going on at the state. I do agree with you that we're doing the best with what we have. We're going to keep pushing the state of Illinois on this. I know that we can get more, and I'm sure we can. And more importantly, I think we want to know where the vaccines are going. And that's the frustration that I won't speak for Karen, but Chairman Cronin and I have, that we need to know where this is going. Quite honestly, we feel like here in DuPage County, we're being treated with not the same way that other counties are. So until and unless we get that transparent response and not the doublespeak that we've gotten, quite frankly, then we're going to continue to raise that as a concern. And if you saw the press conference on Tuesday or read anything in the paper, kudos to Chairman Cronin. He was defending this county. He came out guns blazing. Surprised both Karen and I were sitting in the front, but it needed to be done. And I think it might have gotten the state's attention, and that's exactly what we need to do. So it's the frustration level is high that we don't have the vaccines, but I think it's even higher because we don't know why we don't have the vaccines and where the vaccines are going. And if we knew that, then we could better establish the priority that we have. So we're going to continue to push and continue to get as much as we can because our residents deserve it. Any other questions of Karen? I had a question, Karen. Is it the unknown on race and ethnicity? Is it because there weren't any other categories? Like, is there a category for biracial on there or something else? Is it that people just really didn't know, or they didn't fit one of those categories that they checked unknown? Because that seems to be certainly a significant number of people on the race. I mean, if people don't know what their ethnic background is, maybe I guess that's the true melting pot of America. But to not know what race you are is, for 50% of the people, there's got to be a reason.
Yeah, I'll let Dr. Chug speak to part of it, but it's also not required. And so some people feel like it's kind of none of your business.
Okay.
So I think that's one element, but Dr. Chug?
Yes, Karen, you're right that it is in part the patient either opting to not provide it or what the eye care folks were telling us this week was that about 90% of their data come from electronic medical records that then interface with eye care, and 10% come from providers who are hand entering. And the data from the hand entry or manual entry tends to be a little bit more complete than the EMR interface data, because it's like Karen said, especially from the EMR, if it's not entered, then they don't have to send it. If it's entered, then they are required to send it to eye care. So Illinois Department of Public Health has put out a memo, or a siren as they call it, their health alert, in the past week, to really push vaccine providers to enter health and race and ethnicity data into the file so that it is imported into iCare to really help raise the completion level of that, and so that the data that we're looking at is more representative.
Okay, thank you.
Thank you.
Any other questions of Karen or anyone else? Okay, hearing none, seeing none. Karen, thank you does that conclude your update?
It does. Thank you so much.
Okay, thank you. All right, well, moving on to approval of the minutes. I will entertain a motion to approve the minutes of December 10th, 2021.
So moved. Weeks.
Second, Finch.
Moved by Dr. Weeks, secondly by member Indy Finch. Any discussion, any additions, corrections, or deletions to the minute? Hearing none, seeing none. Since we are remote, we will take a roll call, please.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore.
Aye,
Mr. President, the motion passes.
thank you. The minutes are approved. Moving on to treasurer's report. Mike, I'll turn it over to you.
Thank you, Mr. President. As of December 1st, the Health Department general fund balance totaled $31,302,588.15. Receipts for the month totaled $7,504,413.10, and disbursements totaled $8,495,412.45, leaving a month-end total in the Health Department general fund of $30,311,588.80. Combined balances in all four health department funds as of December 1st totaled $40,634,005.85. Combined receipts for the month totaled $7,533,685.25, and combined disbursements totaled $9,130,446.13, leaving the combined balances in all four health department funds at $39,037,244.97. Investment earnings recorded in the general ledger in the month of December, which is the first month of our fiscal year 2021, for all four health department funds totaled $4,146.87. That concludes the report for this evening.
Thank you. I will entertain a motion to approve the report as submitted.
So moved. Weeks.
Second, Jan Geider.
The motion by Dr. Weeks, seconded by member Geiner. Any questions, or Geider rather, I'm sorry, any questions of Mike? Okay, hearing none, seeing none. Roll call, please.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore.
Aye,
Mr. President, the motion passes.
thank you. And the treasurer's report is approved. Thank you, Mike. Moving on to consent items, I'll entertain a motion to approve the personnel transactions set forth in your packet.
Move to approve, Wilson.
Motion by Dr. Wilson,
Second. Scouten.
second by Dr. Scouten. Any questions, comments? Roll call, please.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye,
Dr. Weeks.
Aye.
Mr. President, the motion passes.
thank you. Moving on to action items, if there's no objection, I'm going to move to combine first items 8(1)A through J. And then after we do that, I'll ask if we can approve those. However, first I'll entertain a motion to combine items 8(1)A through J, please.
So moved.
So- And second, Wilson.
Who made the
I
motion?
moved it. Spadoni.
Motion by Mr. Spadoni, seconded by Dr. was it Wilson?
Yes, sir.
Dr. Wilson, okay. Motion to combine, roll call, please.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten.
Yes.
Mr. President, the motion passes.
Thank you. At this time, I'll entertain a motion to approve items 8(1) through J. Approved.
So moved, Wilson.
Motion by Dr. Wilson,
Second by Spadoni.
second by Mr. Spadoni. Any questions, comments on any of these items?
Yes, this is Jan Geider. I do have a question. Give me 1 minute here to scroll down. I hope I'm not like terribly, I had it up and then
Hey, Janice, you say aye along with me, so you're always going to be okay. So don't worry about a thing. You know, we're you and Dr. Weeks and I are the ayes.
Okay, I used to work for a judge. That's why I'm the I
There
person.
you go. I knew there was a
Okay,
reason.
there was, I found it. Item 8-4-D. Are you including that with those that you're combining right there?
I'm sorry, say
8-4-D, as in David.
well, we're combining them all. So 8-4-D is which one? I actually printed it out, so I'll have to go to it.
I just had a question about.
Go ahead. What's your question?
The question is, what are we using to evaluate the success of this service?
Are you talking about the breast and cervical cancer program?
No, this is procurement. I hope I'm not embarrassing myself or any of you nice, wonderful people here. Procurement approval. Am I in the wrong place here? Because I was trying to scroll down and I had a note there that I read it earlier, and I probably should have called and got some clarification, but I thought I would
You're
ask.
you're ahead of us as usual, Jan.
I'm sorry. Okay,
That's
so no question.
We're-
Okay. And now that we've sufficiently answered Janice's question on that one, we're good.
Okay, Karen, I would like to question when we get there later, okay?
Okay,
Thank
Yes.
you got it. Okay, any other questions or non-question questions, as the case may be, on any of these? Okay, there being no questions, there was a motion, a second. Roll call, please.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr.
There you go.
Hussein,
Yes.
Dr. Munir,
Yes.
Mr. Scouten, Dr. Scouten, sorry, Mr. Spadoni,
Yes.
President Tornatore,
Aye,
Dr. Weeks.
Aye.
Mr. President, the motion passes.
thank you. I'm moving on to item 8(2). Without any objection, I will entertain a motion to combine items 8(2) A, B, C, D, and E. This is to combine at this time.
So moved. Weeks.
Motion by Dr. Weeks. Is there a second?
Second by Wilson.
Second by Dr. Wilson. Any questions on the motion to combine at this point? All right, the motions are combined. Roll call, please.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore.
Aye.
Mr. President, the motion passes.
All right, the items now being combined, I'll entertain a motion to approve items 2A, B, C, D, and E. Is there a motion to approve?
So moved. Spadoni.
So
Motion by
moved.
Mr. Spadoni, second by, I'm sorry, who's that? Who seconded?
Wilson.
Second by Dr. Wilson.
Wilson.
Okay, now, questions, comments. Now, Janice, I think you're up on this one, if you want. But unmute yourself. There you go.
Okay. So agenda item 8-4D. The question is there some evaluation process that will guide us or guide the vendor to make sure there is success with this effort? I hope I asked that the right way.
So that I understand, you're talking about the professional services contract to coordinate healthcare vaccination partners?
Yes.
So absolutely, that is going to be and will continue to be for the foreseeable future a really important element of how we reach out to our community, and where our vaccine, the more limited, I think, the more precious, right, our vaccine allocation is. So we'll be using that individual to help fulfill the mandate as well as the goals of our vaccine program.
Okay, and I'm reading under background history that the consultation will include facilitation for COVID-19 pandemic response focused on intersection of public health and healthcare, and include addressing health inequities throughout the county. I'm assuming, and I don't want to assume, so I'm asking you, is there a mechanism in place to make sure and to target how this is going to be done?
So Chris and Adam, I will let you take a run.
Yeah, Janice, I think the contract and the person is going to help address those inequities, sort of based on what Karen shared about the allocation framework for vaccines. So looking and working with providers that serve high need areas. So they are specifically looking at a couple of geographic areas. Our goal is to recruit more providers in that area who may not be enrolled in eye care yet, to get those providers to request more vaccine, make sure they know what to be able to do, and generally ensure that we have vaccine providers that serve the clients that we're trying to reach.
Okay, Chris.
As well as working, Janice, with the Heart Coalition to make sure that if there are barriers to vaccine, that those are addressed as well. So yes,
Okay.
I don't know that there's necessarily a framework or an evaluation model that's been established yet, since we're on the cusp of this, but we'd of course be very interested in your thoughts.
Okay, I'm glad you said that, because I was in a meeting earlier with a representative from IDPH, and that question came up with the different counties.
Mhm.
Have we investigated, or are we investigating what the possible barriers may be?
Yes. And I think that's part of the work that Mila and all of you are going to be talking about tomorrow.
Oh, okay, thank you.
Yes, yes.
Okay, thank you, Karen and Chris. And Chris, you look familiar.
Okay. Janice, does that sufficiently answer your question?
Yes, thank you.
Any other questions regarding these items? Okay, there being a motion and a second to approve these items, roll call, please.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Schneider,
Aye.
Dr. Hussein,
Yes.
Dr. Manier,
Yes.
Dr. Scouten.
Yes.
Mr. President, the motion passes.
Thank you. Moving on to item 9, any unfinished business, unfinished or old business before the board. Okay, hearing none, seeing none, any new business for the board from any one of the board members? Okay, hearing none, I have some new business I'd like to bring up, and it's just wanted to get the sense of the board regarding discussing an amendment to the bylaws regarding public comment. Tonight wasn't bad at all, but of course, if you recall, a couple of months ago, we spent a couple of hours with over 200 public comments, many of which were or appeared to be cut and paste from a particular group of people. And while it's important to listen to what people have to say. It's also important to do the business of the health department, and also not to necessarily take up an entire day or evening of board members' time, particularly when a lot of what's being said is a repeat of what was said by the previous person. So at the county board, while we're somewhat flexible with it, we do have a 30-minute limit on public comment. I don't know that there is a prohibition in our bylaws for that, nor do I know that it's specifically stated in the bylaws. But if, and I'll defer to Lisa, our counsel, Smith on this one, but is there any objection by the board to put a limit, a time limit on public comment? And if not, then we'll move to maybe be more specific in the bylaws and amend them accordingly so that we're in conformity with that if we do have this limitation. And again, we don't have to be inflexible if we go 35 or 40 minutes because there's a particular item of interest on any given month. We can do that. We can also move to extend the 30-minute limit as we've done at the county board from time to time. So, but it's a framework instead of just going on and on, because when we knew at the last meeting that we had 220 some public comments, I asked Lisa ahead of time if we had to rate them all, and she told me yes. So
and I was the bearer of bad news.
Yeah. So now, I'd like to maybe know that we can somewhat cull that a little bit if necessary. Any thoughts from anybody or any objections to maybe a 30-minute limit? Understanding we still would have that flexibility if the board wanted to extend it beyond that.
Sam.
Looking around, yes, Mindy, go ahead.
So I have a couple of comments about that. So I think it's really important that people have a voice. There's very few places right now where, especially in this time, that they have a voice to communicate out. And I know not everything and I missed the public comment tonight, and I'm very sorry. I was in another meeting. But I think it's important for people to have a voice in any board. I think the problem came in when we're virtual and they submitted written comments that they didn't feel that they needed to be present for. I mean, I think you wouldn't have had 220 people standing there reading the same canned response, which we had letter after letter after letter that were the same. So I think maybe if you did want to quantify it somehow, you put it into, either just a general limit, or you quantify it that if we're in a remote environment, it is capped at 30 minutes, regardless. And that the other minutes, the other comments can be submitted in writing and would be distributed or given to board members to read or something. I don't know if that's even possible, but I think the biggest problem is Penny and Chris read the same canned letter like 100 times, which was, we didn't need to hear that, right? So you wouldn't have that with 220 people standing there. So.
I agree, and that's it's become an issue with electronic public comments because of our virtual meetings, just as it has at the county board, because it's easier, obviously, to sit at a computer and type something out than it is to actually come to a meeting and publicly comment. And again, I think it's important for people to be heard. There's no question about it. And I don't have any reason to want to shut anybody down. I just want to know how you all feel. If you feel that you want to listen to 250 comments that say the same thing, we can do that. Again, I don't think we're going to have that problem when hopefully sometime soon we're all back together in the same room, because I don't think that we're going to have that many people who will actually come. But then if we don't have a limit and we have 5 people who show up, but 300 people who decide to send something in electronically, we're going to be in the same situation. So unless there's a limit of some kind, then it's just an open-ended public comment. And I just didn't know how you all felt about putting some type of limitation on it. Again, with the understanding that if one or two or a few of us feel that there's something of import that may be brought to our attention at any given time, and there's a real rash of people who want to be heard on it, we can extend it beyond the 30 minutes. It's just it's a floor, not necessarily a ceiling.
Sam,
Just an
this, okay.
observation.
I'm sorry.
I'm sorry, just an observation. I'm not sure if it was the board or some other organization, but recently someone capped the open comments to 300 words. Is that something we could legally do?
I think we have, and I know that at the county board, and I think we've pretty much done that, as limited the public comment to 3 minutes. I don't know about 300 words. I think that Penny would have to take a look at everything that came in and start counting the words. We don't want her to have to do that. That would be a bit burdensome, but I think we generally have about a 3-minute limitation. But again, if you have 200 or 220 public comments, luckily when we had that many a couple of months ago, they weren't 3 minutes each, or we would have been here for 5 or 6 hours instead of 2. And also Penny and Chris and Adam were really talking fast that night, which was good. So I don't know. You guys tell me. I'm happy to take a consensus and move on.
This is Lanny. So how do you prioritize the 30 minutes, however many you can get read in 30 minutes, and then the rest go in the public record, or how do you?
Yeah. What we do at the county board is, and we really haven't done it yet because we've pretty much extended it to everyone, but we would read, if they're electronically sent, we would read them in the order that they were received.
Okay.
And also at the county board, if someone comes to the county board in person, we take their public comment first. And then we go to however long the public comment portion is. If it's 30 minutes, whatever's left over, if they've been electronically submitted, those are entered into the minutes and they're made a part of the minutes. They're just not necessarily read aloud at the meeting.
Mm-hmm.
So people still get a chance to comment, and you can read them in the minutes, that you're just not going to hear them necessarily at that meeting.
Gotcha.
It would help everyone to know too, just a little bit of the background on it too. The public comment gets cut off 15 minutes before the meeting starts. So they can make public comment up to 6 o'clock before the meeting. And then the way that it's set up on the form, it is limited as to how much they can put. There's just enough character spaces. So it's not set up that there would be like 5 minutes worth of one public comment. And then the other thing just to keep in mind as you take this under consideration is at that one where you did have 225 public comments, you did have a lot of, to Mindy's point, the same thing that was said over and over and over again, but within that last 15 minutes, right before the meeting, a new set of public comments came in on a completely different topic. So that's another thing just to keep in mind as you make your determination what you want to do, that like I said, that last 15 minutes, all of a sudden something came in all about vaccines and everything else had been the school framework prior to that. So just a little, information for you as you make your determinations.
And I can promise you that as long as I'm president, if someone chooses to come to one of our meetings and make a public comment, they'll have an opportunity to be heard. If we have to go beyond 30 minutes because we have 20 people who choose to come at a meeting, I think they ought to have an opportunity to be heard. Unless it's an obvious ploy by, someone to make a political statement or something against one of us or the executive director. And but if it's a legitimate public comment, I think if people come to the meeting and they've taken the time to do that, they certainly have an opportunity to be heard. So
to your point, Sam, this is a a ceiling or floor. You know what I mean? It's not. There's flexibility here for the board's discretion, and so I think that's the important part to keep in mind.
Right. We just want to make sure that if we do want to cut it off at some point, we have the authority to do it in our bylaws. That's
Exactly.
so we would want to amend the bylaws to give us that authority. We don't have to use it if we don't choose to.
Sam, is your recommendation to bring forth at the next meeting what they do across the street at the DuPage County Board? Show us that, and we'll have an opportunity to vote on that.
Yeah, what I'd like to do is with Lisa is prepare an amendment to the bylaws
Okay.
to be brought to the board next month, at which time we can move that amendment, discuss it, and either pass it up or down, get an up or down vote on it. And really, that wouldn't go into effect until the following meeting.
Sure. I'd be interested in seeing that, and I'd be interested in having that discussion.
Okay.
I
I agree. I also think if you're going to propose an amendment, you ought to propose a time limit on each person being able to speak to. That's not an
Yes.
uncommon thing that I see, you know, in various political testimony, you know, that I have to give. There's time limits along with an entire time limit. That doesn't mean you can't extend it beyond, like you said, Sam. So I think those are both good two suggestions.
I think essentially what I'd be recommending is mimicking what the county board has, the 3-minute limit and a 30-minute total limit. 3 minutes per person, 30-minute total. With the flexibility to extend it if we wanted to. Okay, so if there's no objection to that, Lisa and I will work on that and have that for us on the next meeting. That's all I had under new business, other than to say that just thanks to our staff for their hard work over the last 2 months. Since we last met, the vaccines come out. There's been the vaccine rollout. There's been a significant amount of people who have been vaccinated. There's obviously a significant amount of angst about who can get vaccinated and when. We hear it. Our staff hears it. I hear it as an elected official as well as a member of this board. I hear it every day. And I'm sure many of you do as well. And all we can do is tell the people what we've done. We have the infrastructure in place to vaccinate many arms. It's just a matter of getting the vaccines. And the sooner we get it, the quicker we can get it into the arms. And we're doing it. Now, we're not trying to do it equitably. We're doing it equitably, which is different than some other counties, quite frankly, who are taking some different routes in terms of getting into the arms. So congratulations and kudos to our people for doing that and working so hard as they are. Anything else from the board? Any other new business? I'm looking around. I don't see anything. Okay, our next meeting will be March 11th, 2021. I assume we'll be virtual again. I can't wait till the time we can all get together because Janice is waiting for me to bring pizza that night. She reminded me the other day, and I will. That promise will be kept. Okay, I assume we have no executive session, Penny, right?
Right.
Okay, we have no executive session. I will entertain a motion to adjourn.
So moved.
And second.
Motion by Dr. Scouten, seconded by Dr. Wilson. There being no discussion, roll call, please.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks,
All right.
Dr. Wilson,
Yes.
Ms. Bottoms,
yes.
Ms. Finch,
Yes.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir.
Yes.
Mr. President, the motion carries.
Thank you. We are adjourned, everyone. Stay healthy, stay safe. We will see you
Thanks.
next
Bye.
month.
Bye. Have a good one.
Bye.
Bye,
Take care.
everybody. Thank you.
Call everyone. Thanks, Penny.
You're welcome. Bye, everyone.